Hello everyone, welcome back to our Fine Nursing Tutorial YouTube channel. In this class, we are going to discuss with important MCQs which are helpful for your competitive exams. Who all have visited first time on this channel, please do subscribe and watch. We'll see the first question. While recording intake output, nurse has to consider insensible water loss from human body and the normal is. Options are given. 800 ml. Second question. Which one of the following indices a nurse has to consider as an indicator of good nutrition? Options are given. Total lymphocytes 1900 per microliter. We'll move to the next question. Before endotracheal intubation, some facts about trachea a nurse has to understand, and all the following are true regarding trachea except. Options are here. It starts at the level of 7 cervical vertebra. Next question. When assessing a patient with appendicitis, how a nurse must initiate to get information? Tell me how you are feeling. Next question. Which guideline a nurse has to follow when caring for pressure sore? Dressing to dry before removal. Next question. What should be the position of the limb a nurse should maintain in a patient who had undergone right hip prosthesis surgery? Abduction. Next question. A post-operative patient develops evisceration. What a nurse should do? Cover the protruding organs. Next question. A nurse is caring for an old lady with osteoarthritis. And all the following facts are true regarding osteoarthritis except. Sophie. Next question. How a nurse will teach breathing exercise for a patient with chronic bronchitis? Use diaphragmatic breathing. Next question. A nurse caring for a head injury comatose patient, which intervention he or she should implement to prevent increased intracranial pressure? Elevate the head end of the patient. Next question. What recommendation a nurse should give to 55-year-old patient with a blood pressure of 150 by 90 mm of Hg? Recheck your BP 2 weeks later. Next question. Which one of the following viruses cause post-transfusion hepatitis? Hepatitis C. Next question. What is the usual site of intramuscular injection a nurse choose in an adult for Z-track technique? Ventrogluteal. Next question. How a nurse will have to collect urine sample for culture from urinary collecting system? Options are here. With needle aspiration. Next question. All the hormones are secreted by anterior pituitary except. GRH. Next question. Glycated hemoglobin tests mean glucose levels. Over 90 days. Next question. How do you know that intercostal drainage tube is functioning? Oscillation of water column in drainage bottle. Next question. A subjective feeling about what is right or wrong in psychiatric medicine is said to be morality. Next question. Nurse has to apply erythromycin ointment to a newborn child. Which area of eye she is supposed to place it? Lower conjunctiva. Next question. Fluid overload in a patient may cause pulmonary edema. Next question. All are true regarding Helicobacter pylori infection except is gram-positive bacteria. Next question. Which one of the following statements by a patient with backache should alert the nurse? Pain radiating the leg. Next question. The purpose of lymph nodes is to trap antigens. Next question. Cytokines are chemical messengers which options are here, which promote inflammation. Next question. The thymus related T cells produce recognize body's own cells. Please like, share and subscribe to our YouTube channel for more informative content. Thank you for watching.